Can you describe what clinical agility is and what is the value in healthcare?
Clinical agility is about applying agile work paradigms in the healthcare enterprise. It's actually about being able to respond quickly to changing external conditions without compromising long-term objectives. So the purpose of this is to make healthcare organizations ready and more adaptive to solve the many challenges while operating in a very volatile, uncertain, complex, and ambiguous environment like healthcare.
In your presentation, you made reference to the impact of COVID-19 in precipitating healthcare's acceptance or ability to become agile. Can you expand on that?
Yeah, of course. And I see three things. First, I think in the beginning of the pandemic, there was a sense of urgency to address more pressing needs around patient care, which was geared towards ensuring care continuity. So those centers or healthcare institutions that operated with agile principles, knowingly or unknowingly, they could actually ensure care continuity and limit the impact and reduce the collateral damage of COVID-19. Second, beyond this initial wave, of course, COVID-19 has triggered a couple of other challenges that have longer-term implications that we probably cannot address with traditional linear change management approaches. So they do require that collaborative work in networks across care settings and with more patient inclusion. We see that these things have started, and I think that in itself has triggered this need for clinical agility too. And third, COVID-19 has created a big need around care virtualization and remote work, which required the patients and clinicians to embrace digitalization. And as you know, digitalization has very short innovation cycles. Only those organizations that are able to actually adapt themselves to those tools in a very quick fashion can exploit the full value of digitalization sometime soon. So those are the kind of three things that I do see in different time horizons happening.
Can you elaborate on how digitalization of healthcare actually enables agility and vice versa?
Yeah, indeed, there are both angles. So first, a successful digital transformation requires clinical agility. So that directionality is correct. So since digital tools are evolutionary, there is no endpoint for transformation. So any product will evolve continuously and in short cycles. So applying agile work principles provide the ability to transform most of the hospital workflows faster, and to do this in a decentralized fashion with self-organized teams is then also a possibility that agile brings with it. This way, there is no change imposed on the organization, but the change is a continuous adaptation of the stakeholders to the enhanced digital opportunity. So it's not a traditional change environment, it's more this embracing of change as a part of your regular work, basically. It's adaptation rather than change. The second thing, the other directionality that you said is also true. So digitization is not just a beneficiary of agile, but also an enabler for agility. For instance, along the care continuum, the care team around the patient changes a lot, right? So, and a lot of information requires handovers from one team to the other, one person to the other. In a routine, regular, non-digitalized environment, this is not only cumbersome, it's also slow and prone to errors. And that actually hinders a little bit also the change management capabilities of the organization because it's so complex to do those changes in such an environment. So many digital health tools, on the other hand, support care coordination, and they do provide contextualized provision of patient data. That in itself makes care flow changes much easier to plan and implement, and with that increases the clinical agility of the organization. So with that, we have actually a bidirectional impact. So they do impact each other, digitalization and clinical agility.
Thank you very much, Okan.
Thank you, Michael.